Hey, how are you? You're watching What Women Want on Pinky TV. My name is Pinky Ghelani, and welcome to Season 3. It is Unlearn. These conversations are brought to you by SBM Bank, and as usual, we have phenomenal guests for you who open up, completely open and honest on this show and give you valuable lessons, I believe so. So make sure you tag a friend, whether you're watching this on Facebook or YouTube. Share this as much as you can as well. And if you are on YouTube, subscribe to the channel so you are amongst the first to watch episodes like this. Today we are joined by somebody who has a very interesting story, Dr. Kristina Sule, who's not new to the What Women Want platform. And of course, we've done some shows together. Kristina, thank you for being here.
Thank you so much for having me. I really appreciate it.
Yeah, I'm so excited because you have so many little nuggets that I'm going to, sort of get out of you. But first, if you've been watching this season, we say this to all our guests. We want our, the women watching or the people watching to completely own who they are. So we're unlearning this whole thing of being introduced. So unapologetically introducing yourself. So maybe you can tell our audiences who you are. Introduce yourself.
So my name is Dr. Kristina Sule. I'm a consultant obstetrician, a general and cosmetic gynecologist at Alora Medical Practice. That's my private medical practice. And I'm a mom, I'm a wife, I'm a daughter, and the unapologetic part actually does not come easy for me, despite what everyone thinks. It doesn't come easy to me because maybe because my field is very new in Kenya, cosmetic gynecology. So, to come and say, oh, I'm a kick-ass, cosmetic gynecologist is really difficult for me. But yes, I'm a kick-ass cosmetic gynecologist. And yeah, that's basically who I am.
Wow, see, that's what I'm saying. So many nuggets. You're going to thoroughly enjoy this show. Okay, Kristina, so, or should I call you Doctor?
You can call me whatever. It's because we're friends that you want to call me, so it's fine.
Tell us a little bit about your upbringing. It's very unique. I understand that you've had a chunk of your life or part of your life being brought up in Ukraine.
Yeah. So I was born in Ukraine to, let me say, mostly Kenyan parents. So my dad is Kenyan, my mom is half Kenyan, half Ukrainian. So I was born in Ukraine. My grandmother is Ukrainian. And I lived in Ukraine for probably almost the first year of my life before we moved to Kenya. And my dad started lecturing in the University of Nairobi. And my mom was a pharmacist by profession initially, and then she changed her profession to become an advocate.
Oh, wow.
Yes.
Wow,
and
okay.
I grew up in Kenya, and then at the age of around 6, I went back to Ukraine. So we traveled a lot for the summer to Ukraine from the time I was 1 to the time I was roughly 6, and then I went and lived with my grandma there for about 3 years.
Wow.
I went to school there. I loved it there.
Did you?
I did.
Was it interesting to be a Kenyan girl, although you have Ukrainian blood, in Ukraine growing up in those 3 years? From 6 to 9, right?
Yes. Yeah. It was really interesting being in school. The interesting thing about children is they don't really see color the same way adults do.
Yeah.
So you physically see it, but you don't see yourself as being different from any other child in that school. And so to me, I felt myself almost the same as every other child. But there was a lot of, racism that I had to encounter because it's Eastern Europe.
Yes.
People weren't exposed to, different cultures.
Melanin.
Exactly. Let me just say that, yeah. So I was the only black child in my entire school of maybe 1,000 children.
Wow.
But my grandma found a way to, so in Ukraine you can find a way to kind of privatize public school. So you can say that you'd like your child to attend a smaller group of children in a different facility, and my school had that. And so my class was just about maybe 20 kids, as much as the larger school was maybe a walking distance from where I was actually learning. And it was much more homier, and we'd get our meals there, we'd sleep there, and we'd have an afternoon naps there, and then our parents would come and pick us up. And so yes, there was quite a bit of racism, but I feel like my grandma kind of made it, what can I say? She buffered me. Yeah, she buffered me a lot, and she encouraged me a lot, and she did it in such a proud and obvious way, and she'd be like, of course you're the best, what do you mean, you're the best child in that school, and so she made it a lot easier for me. And in retrospect, when I look at it, I'd be like, oh my God, how did I survive that? Because it was really tough. But
because it can be extremely traumatic, especially in that age, which makes such an impact in your life. Well done to your grandmom. Is she still with us?
She is. She is. Yes, it's her birthday this month. She turns 84.
Amazing. Yes. So she's still does she still have an impact in your life?
She does. She does. She is very much in my life. She's my mom because she raised me at that very difficult time in my life, and she's probably my biggest cheerleader with my husband. And she is extremely present in my life.
That is amazing. That is so nice to have a strong woman who, despite, she could have sort of caved and given into what society thinks, what will people say.
Exactly.
So good for her. That's why you are the way you are, I guess. So do you speak Ukrainian?
I speak a little bit of Ukrainian. I speak fluent Russian.
Oh, I speak Russian.
Do you?
Vodka.
A lot of people know that word, So, I speak fluent Russian. My grandma doesn't like it when I say that. She's a very nationalistic Ukrainian.
Okay.
So, of course, she'd prefer for me to say that, I know Ukrainian. So, I do understand Ukrainian completely, but frankly, I'm not as fluent in it as I am in Russian.
Can you teach us a word?
In Russian?
In Ukrainian.
In Ukrainian? Yes, I can.
Okay, can I ask you this? Because you're a gynecologist, how do you say vagina in Ukrainian?
Oh my God. Okay, so I can say it in Russian. It's called vlahalishe.
Vlahalishe.
Yes, vlahalishe.
Check on your vlahalishe.
I have no idea what it's called in Ukrainian, honestly.
Okay, I hope your grandma doesn't see this.
She's gonna hate me.
So now you don't have siblings. You're the only child. Come back to Kenya, and you go through high school, etc. What was your those years? What were they like? Did you make good friends? Was it easier for you to integrate into schools over here? Did you miss your grandma?
I missed my grandma a lot. She missed me more than I missed her.
Of course,
Not because, just because she's an adult. And I remember her sending me letters and saying like, I'm sorry.
No, it's okay. Do you want a tissue? Oh my God, I didn't mean to make you cry. Take a deep breath. It's okay, we can get you a tissue.
Sorry.
It's okay. It's okay.
I don't really talk about this much.
Oh, I'm sorry. I hope you're
I'm not even upset. These are happy tears.
Okay, good. I'm glad they're happy tears. Because I really would love to know what your...
Thanks. I'm going to ruin my makeup.
Oops, makeup.
It's fine.
I'm so sorry. So you can tell me about what your grandmother used to say to you in the letters.
So she'd send me letters and say, like, yesterday I was walking in the park and I grabbed for your hand because it was a reflex. And so, so she missed me a lot more than I missed her. When I came back, I was about 9 years old, and I had to get into 3rd grade. And funnily enough, I went back to the school that I had left from when I was 6 years old, which was, I think, a good thing because I remembered all my friends, so there wasn't much integration that I had to do at that time. However, I spoke very little English by the time I got back.
Of course,
I'd forgotten almost all my English. I didn't speak Kiswahili at all. And it was an 844 city council school, so you needed to speak Kiswahili. It was an examinable subject. They had these other subjects like GHC, geography, history, CRE, Christian education. They had, home science, music, and all that. And I didn't know any of that, because in Ukraine, the education, especially when you're younger, is very focused on language and mathematics. And so I was excellent in math, because the level of mathematics education is very high in Ukraine. Yeah. So what I was able to do when I was 9 is what we were doing in class when I was 14.
Wow.
And so I was really good in math, and I could, pass an English exam, and then I was really good in music, because my grandma had enrolled me into piano school in the Ukraine, in the conservatoire, so I could play piano very well. very easy, very easy in Kenya. It was almost, childlike to sit through that music exam, and I was like, this is ridiculous. This is the easiest thing I've ever done. So I'd get, 100 in those, and then, close to 0 in the rest. Yeah. But in about 4 months, I managed to do so much better, and in about a year or so, I was top of my class.
What?
Yeah. Wow. And so that was, good for me. At that time, my mom encouraged me a lot, because now I was living, here with my parents, and my mom was very instrumental in, because, I'd ask her, how am I going to, because she'd tell me, you're going to get to the top of the class. I'd be like, how am I going to get to the top of the class? I don't speak English. Yeah. I barely speak English. I barely, know anything these children are learning about. So how is that going to happen? She's like, yeah, it'll happen, and then you'll be the best, and, you'll be a doctor. And so she used to tell me those things, and the funny thing is, what I take from it is that the things we tell our children, they do remember them. They keep them, and sometimes these are the only voices that they hear, when things are difficult. And so it's really important what we tell our children, how we say it to them. Because if there's anything I remember my mom ever telling me, is that you'll be the best in your class, and you'll be a doctor. All the time. And the reason she used to tell me this, sorry if I'm, digressing.
No, it's so interesting.
But the reason she used to tell me this is that she had a lot of difficulty conceiving me. It took almost 4 years to conceive me. And she was very young when she got married. And many doctors told her, you'll never have a child. Like, from what we're saying, this is impossible. Yeah. And she told me that at that time in her life, she became extremely prayerful. And so she said that one of her last gynecology appointments, she prayed before she went, and she told God, like, if you don't want me to get pregnant, let me stop, going to all these doctors, doing all these tests, doing all these fertility treatments. I'm so tired. And she was so young. And actually the gynecology appointment she had before that, her gynecologist was like, don't worry, you're going to get pregnant, and you're going to get a daughter, and she's going to be a gynecologist as well. I swear.
Who are these people? They need to prophets.
Yeah. Right. And so she went to see her gynecologist the next appointment, and she was pregnant. And so she always used to just say to me, I believe that she believed that as well. But so to me, it's really important what you tell your child and how you tell it to them, because, I'm exactly what she told me I would be.
Yeah. What do you tell your child? She's 5.
She's 5.
Oh my God.
So right now, I just, try to encourage her about how smart she is, about how good she is. I know that's really hard with kids, because I didn't grow up much around kids. I don't have any siblings.
Yes.
So it's difficult for me to relate to her in that kind of manner. I've always related with grown-ups, always.
Okay.
And so it's difficult for me to relate with her in that kind of manner. But what I try to tell her is, no, you're smart, you're good at this. Yeah. You're doing this so well. So those are the things that I try to tell her. And honestly, sometimes it's hard, because, they're singing and they're completely off tune, and you're like, you're singing so well, and you're thinking, So, yeah, but I do try to
come across this when she's 16. She'll be like,
no, just like you should have told me. No, but I mean, I feel like for a child her age, she is brilliant. And when I tell her that, it's the truth. Yeah. But I do try to encourage that in her. I try to tell her, like, when she's doing a puzzle, you need to think about this. You need to take some time. Don't give up. Just like, because there'll be so many times in life where she'll have these life puzzles that she'll have to think about and to put together. And if she doesn't learn patience and concentration now, then it's going to be difficult.
Wow, that's interesting. I'm going to steal that from you and teach my kids that as well. Like, there will be life puzzles. There will be life puzzles. Okay, so then you got into gynecology, and this you studied here.
Yes, I did.
In Kenya. Gynecology, yes, I can see it, you know, I can see Kenyans embracing it or teaching it even, but cosmetic gynecology, what made you think, okay, this is interesting and this is what I want to study? And was this available in Kenya or did you go out of the country to study it?
So this was not available in Kenya. I have to say that when I was about 14 years old, I knew I was going to be a gynecologist.
Okay.
I didn't know how it was going to happen, and it was really difficult for me because I wasn't very hardworking at that point in time.
Yeah.
But I did go to a very good high school. I went to Precious Blood High School, Riruta.
Okay.
And it is a very academic high school. They do enforce...
Does it have a nickname? Because I know
PB.
I know they all have the fancy nicknames.
Okay, that's how boring it is, you know. Because they're very extremely academic, especially when I was there. It was extremely academic, and they were very strict about enforcing Christian values and high academic standards. And I think I needed that in my life at that time. So many people who leave the school say, oh, I hated it. It was so strict. It was this and it was that. But I didn't actually hate my high school because I had an idea of what I wanted to become, and I already knew at that age that this school is making me that. And so I did, you know, decide to go and do medicine. I have to admit that I did try out other things as well. Before I went to do my medicine, I studied at Strathmore University, but that was only a semester because we hadn't gotten called to university yet, and I was still exploring the possibility of becoming a lawyer.
Oh, wow.
And so I did an accounting course which had a law course there. I didn't really do well at it, and I find that so strange to say because people always expect doctors to do well in everything, but I actually failed.
And also because you were so good in maths.
Well, my being good in math didn't even help me with accounting. I don't know. Yeah. But yeah, and many times I asked myself, you know, why am I here? You know, why am I doing accounting? I loved law and I did well at it, but I didn't do well at accounting or at economics. And the funny thing is that my dad has a PhD in economics and did so poorly, and he was extremely disappointed. But I met my husband.
Oh,
and so
that's why you were there.
That's why I was there. So I met my husband, and he's really good at accounting and math. He's brilliant. Generally, you know, and so that's where I met him, and in retrospect that made sense, those 6 months of, you know, kind of just being in between stuff, because when I got to med school, I was like, this is where I'm meant to be. Everything here makes sense.
Oh, wow.
I enjoy everything. I remember, you know, it's not easy, but it's flowing. Yeah, it was hard, but it was flowing.
Right.
There was no chaos like there was in, you know, accounting for me. I think I'm just not, you know, meant for it in general. And then during my medical school training, I did get, you know, some distinctions. And the funny thing is the distinctions that I did get were in obstetrics, in orthopedics, and in psychiatry. And so I knew that I wanted to be a gynecologist, but when I finished medical school, I worked at Gertrude's Children's Hospital. Okay. And for that time, I really thought that, oh, maybe I should be a pediatrician, because my mothers responded to me so well. Yeah. And I was like, okay, maybe this would work really well. But during that time, I decided to have some volunteering time. And so I volunteered at Pumwani Hospital for about a year and a half. And then I volunteered at Kenyatta for a year and a half as well for in their maternity unit. And that's when I knew that I felt bad for almost forgetting that I had wanted to be an obstetrician all along. Yeah. And I was like, yeah, I remember now, this is what I was supposed to do. And so for cosmetic gynecology, I had to go to the UAE. How I ended up doing that in this very strange, you know, kind of place is that when I finished my master's training, I started applying for some jobs. I was a self-sponsored master's student, so you can either be county-sponsored or self-sponsored. Okay. And if you're sponsored by the county, you have to go back and be bonded in the county and serve, you know, your time in the county as a county consultant. But I was self-sponsored, should I say husband sponsored, because my husband sponsored my master's education. And so when I finished, I basically did not have a job, and I applied at several hospitals, and sometimes it takes time for them, you know, to respond. And in this time, I thought maybe I should look for a job outside this country. And it was a really sad time for me because I couldn't believe that I was a consultant and I couldn't get a permanent job in this country. I mean, I could get small part-time jobs, but I couldn't get permanent employment. And during my master's, I did a thesis on high-risk pregnancy, and it was accepted for presentation on maternal-fetal medicine in Las Vegas. So I had to travel to Las Vegas, and when I got there, I found so many professionals in high-risk maternal-fetal medicine field that it kind of discouraged me, because for me, I feel like in your career, you should try to get to the top of your field. And there were already so many people at the top of this one, and they were so good at what they did. And I was thinking, I'm never going to get to the top of this field. Like, I'm good at it at my level, but when am I going to be a professor in maternal-fetal medicine? So when I came back, I was really discouraged, and I started to look for a job outside the country, specifically in Dubai. And then when I realized that it was possible, I started looking at the qualifications of some of the doctors who worked there, because it made more sense to be a female gynecologist in Dubai because it's an Islamic country, and it made a lot of sense. And so when I saw that some of their qualifications were cosmetic gynecology, and I'd heard of it before, but I'd never really looked into it. And I felt like, oh man, it's so pretentious, and like, why would you do that? And then when I started looking into the work that they do, I noticed that it involved a lot of attention to detail, a lot of symmetry, a lot of being meticulous. And I was like, that's exactly who I am. I need things sometimes to be in a perfect way, symmetrical, you know, really perfect. And so I remembered that when I was going through my master's training, every time I'd do a cesarean with a senior consultant, we'd go through the cesarean, and then we'd get to the skin. And some of my mentors still say this about me. And then I'll start taking my time to bring back the skin to almost exactly what it was before.
Wow.
And so one of my consultants asked me, like, why do you do this? Like, the point is to get the baby out. I'm like, no, but this woman is going to go home, she's going to undress in front of her husband. He's going to look at that scar. It's going to need to look the best it possibly can, you know, at that time. And they were like, no, but the point is to get the baby out. I was like, yes, but the point is also for her to be able to still become a wife after she's become a mother. And so when I realized that about myself, I said, then maybe this is something that I should do. And the more I got into it, the more I loved it. It was amazing. The more I learned about it, all the surgeries that were involved, all the non-surgical procedures. And then when patients started coming in, and I'd see how their marriages would get better, how their relationships would get better, how their outlook of themselves, how their sex lives would get better, it just gave me more and more encouragement. And I honestly don't think I can do anything else at this point. Yeah.
So basically with you, what happened in Vegas stayed in Vegas. It's just you like, okay, that happened, and it's staying there.
For sure.
But when you talk about, you know, a time where you, as a doctor with a degree in Kenya, could not find a job.
Yeah.
What, and this is sadly, you know, it's not just you, it is the case.
It is.
And it's rampant in this country. But what was your self-talk, aside from, okay, I need to get out of this country to get a decent job? What else did you say to yourself to keep going?
Well, initially a lot of bad things, you know, like I'm not good enough. I should have attached myself to a county where now I'd be employed.
Okay, so you were regretting that decision. I
was like, why was I self-sponsored, you know, which is very strange. I don't know, it doesn't even make sense to have regretted it, because I never worked for any county.
Yeah.
I finished my internship in Aga Khan, and then I worked in Gertrude's, and then that was it. After that, I went for my master's.
Yeah.
And so it was an unrealistic regret to start with, because I was never in the county system anyway. And so I was like, well, I should have, you know, then looked for a county job, you know, gotten sponsored by the county to do this. And so initially I was like, maybe it's because I'm not good enough. Maybe it's because I'm self-sponsored. Maybe it's because, you know, I don't have sufficient experience. And initially I can say that the self-talk was not good, but it got a lot better. When I came back from Vegas, I spoke to a few people in Vegas who are doctors, and you know, the process of becoming a medical doctor in the States is much longer than it is in Kenya. And so they didn't even understand what my rush was to go into anything. They were like, oh, we're still studying and we're like almost 40, so I don't understand what your problem is.
Calm down.
Yeah, they're like, relax, take it slow and all that. And so when I came back, I was definitely much more relaxed. I was definitely open-minded. My self-talk was influenced a lot by my husband, and he was like, I'm here to cushion this process for you. Like, what do you feel like you want to do? Do you want to do your subspecialization in cosmetic? What do you feel like you want to do? And so at that time, we both decided that I should open my private practice, which was extremely early in my field. Most people do not open their private practices unless they've been, in practice for a very long time. Yeah. And so I decided, I think this is something that I could do because it's not like I have a permanent job anyway, so I might as well get into private practice. And so this situation of mine forced me into private practice, and I'm so glad that it happened because it was the best decision I ever made. Yeah. I got to control my schedule. I got to see the kind of patients that I want. I got to have breaks, although those are becoming much less, and I do regret that because, it is a business. And so one of the things that I had to unlearn in my business is that as a doctor, we are taught to sit in your office, be brilliant, and expect that patients will come in. But when you become a young doctor, you realize that's not going to happen. You need to get patients into your office. You need to tell them what you're here to do for them, and even when they get in, they need to have a fantastic service. They need to have an awesome experience. They need to like sitting in your office. They need to like the information you're giving them. They need to agree with you. They need to be in the process of your decisions, and that's not something that very many doctors have. They're not able to include their patient in their decision. Even when the decision is categorical, they need to be able to, explain it in that manner and have their patients included in their process. And so that's something that I had to learn. I'm like, oh my God, this is a business. People expect a service. People expect to be treated a certain kind of way. It's not just take this medication because I'm clever and I said so. Yeah. It doesn't work like that. And so that's something that I had to learn, which is very difficult. Yeah.
That's so interesting that you say that. For me, in my 30s, I had like 4 miscarriages. And, just the way the doctors, we call it the bedside manner. Yeah. It'd be like, but you don't understand. Yeah. I'm feeling empty. I feel a loss. I don't understand this process. I remember my first miscarriage was, there's no heartbeat. And I was like, but what does that mean?
What does that mean? Yeah.
Oh no, you need to go see your gynecologist. That was, but I was like, tell me what that means, instead of sort of taking me through it slowly and saying, look, this is, or even my gynecologist for that matter was just like, this happens, and go home and do this, and we'll give you another 2 weeks, and maybe it will, and maybe it won't. And I was just like, but
I just lost something.
Yeah, are you telling me that my baby won't live? And is this how you just tell someone?
I know.
And then I remember the letter as well, the language that was used. It traumatizes you. So I'm glad that you.
Yeah, I think as doctors we see so many of these cases that we get a bit jaded.
Exactly.
And so I think with every patient we have to remind ourselves that, listen, this is somebody who is in a family. They were looking forward to this experience, or even sometimes it's just the diagnosis. Like, I had no idea I have fibroids, and now you're telling me that this is what I have. You're telling me I need a surgery.
Yeah, and my life
is going to change.
Altered,
I can't go to work. Like, am I going to be able to have a baby? Things like that.
Yes, absolutely.
And so those are things that I needed to learn in private practice. And I feel like when you start your private practice very early, you're going to learn those lessons very fast. Because in the government, unfortunately, people don't necessarily take their time to, and they can't even, when you have 50 patients waiting,
there's no
way for me to say, I'm so sorry you're going through this,
And, cry in my office.
Exactly, so it's a lot different, but so that's how basically I went into cosmetic gynecology and private practice, and I haven't looked back.
I have to ask you, as a gynecologist, having a baby, how did you choose your gynecologist? And were you like micromanaging? Wait,
I was.
Let me see, is it all okay?
Man, it was crazy. So I'm generally a slightly controlling person. I think many doctors are. We want to be able to, be in control of the situation. And so I chose my gynecologist. So I had one gynecologist previously before I ended up with the one that I, ended up with. Yeah. But because I knew what a gynecological exam and what a patient is, so I was not happy with that service. Wow. Because I was like, well, I can list a few things that you didn't do for me, and I'm not okay with that. And I had a small misdiagnosis as well. It wasn't really, the gynecologist's fault, but it did happen, and it's something that I had suspected already. So it's really hard to be a doctor and a patient at the same time. Yeah. And so the doctor whom I chose is someone whom I had worked with in Aga Khan very closely, and I had seen how he treats his patients. He probably didn't know that that's what I was observing, because way before I got pregnant, I already knew that he was going to be my gynecologist. Okay. Because of
the whole family of prophets and everything.
No, because I was like, if I ever get pregnant, this is the guy. Like, I love how he works with his patients and so on and so forth. And so I knew that, but I was a very difficult patient. I asked so many questions. I would come, with articles about this and that. And luckily, I had an uncomplicated pregnancy, so he didn't have much to answer. But the actual delivery was so dramatic. So I wanted an epidural. And so when I was 32 weeks old, I made an appointment with an anesthetist. I chose the anesthetist that I want. I told them how I wanted the epidural done. They explained everything to me. I signed the consent. And then the anesthetist whom I wanted, I didn't manage to get at the time when I was pregnant. So when I went into labor, I went into labor over Easter.
Oh, wow.
And my anesthetist traveled to Pakistan.
Oh, no.
And I couldn't believe it, because I didn't really care about the labor. I just didn't want to feel pain. Yeah. And for me, this was the most important thing. And I had said it over and over again throughout my pregnancy to my gynecologist, to the anesthetist, like, I do not want to be in pain. Mm-hmm. I know I can have a painless labor, so I best get that. Yeah. And so, she traveled to Pakistan, and then she gave me a different anesthetist. And now I was in the thick of labor. And he tells me that he's in the middle of a craniotomy, which is a brain surgery.
Wow.
And that was going to take so many hours. And so, of course, I was already yelling and all the, foul language and everything. Yeah. I just couldn't help myself. I was in unbelievable pain. And so a third anesthetist was called to do my epidural. And she was amazing. She's actually the one whom I had wanted from the very beginning, but I actually couldn't afford her and couldn't contact her at that time. And so she did my epidural. She was amazing. She told me, I've done this a million times. You're going to be pain-free in a few minutes. I had an epidural myself 6 months ago, because she had a 6-month-old baby at that time. And she's like, and I asked her, is the epidural process going to be painful? And so she says, not more than what you're going through right now. And so I had an epidural, and it was amazing. It was patient controlled. And then just before I, started to push, they came and switched it off, which is not what we had discussed. Yeah. And I didn't know that that was going to happen. And so I then, put it back on myself.
Of course, because you were
yeah. So my gynecologist was like, well, no, it's going to be off. And then he switches on, the pain labor medication, the oxytocin. So I switched it off. And so he was like, listen, there can only be one gynecologist in this area. We cannot do it together. It has to be me, or you really have to comply, or else I cannot manage your labor. And so eventually I listened. It was actually a very good labor. I just had 12 minutes of second stage of pushing, and my baby came. It was the best moment of my life. Yeah. But I was a very difficult patient. I was so apologetic afterwards to all the nurses, to my doctor, and I was just like, I promise I won't have another. Yeah.
My God,
it was really bad. Yeah.
So it was good. For you it's fine. For you it's okay. Yeah. So cosmetic gynecology. Yeah. Why would you suggest women look into this? And what does it do? Because you just said, that you've seen how it helps women when they walk into your office after a few sessions. Maybe they walk in more confidently. It helps relationships. For those of us who don't know, maybe you can just elaborate a little bit about what it can do for a woman, and because this option is available, maybe they should look at it?
Yeah. Well, the reason why women kind of have to look into cosmetic gynecology at some point in their lives, even the ones in denial, the reason why they have to is because there's two processes that generally seriously affect our reproductive system, and that is childbirth and menopause. And so whenever a woman gives birth, there are certain things that are going to happen to her body, whether she likes it or not. So some women experience vaginal laxity, which is, looseness in the vagina. And that will happen especially if you've had vaginal deliveries, and if there was many of them, it happens even worse. And even for those who've had a cesarean section, sometimes because of hormonal changes, they can get vaginal laxity as well. Sometimes women have a very traumatic delivery where they have to have an episiotomy, where they get a tear in their perineum, and that has to be repaired. Okay. And sometimes the repair isn't done well, and sometimes even when it's done well, it really affects their sex life afterwards. So they get a lot of vaginal dryness, they get low libido, which generally comes even with breastfeeding, with lack of sleep, with stress and all that. And so in terms of laxity, that's definitely something that you may have to deal with at some point in your life. In terms of vaginal dryness, in terms of low libido, anorgasmia, these are all problems that happen a lot after baby. Now, when you get to menopause, there's a lot of aging processes, that happen. So again, we start to get vaginal dryness all over again. We start to get our hot flashes. Even the anatomical structure of the vagina completely changes. It becomes much thinner. It becomes friable. They tend to bleed during sex. They get a lot of dryness. Mm-hmm. Yeah. So it's gonna happen. and then they get something called genitourinary syndrome of menopause, which now where they get incontinence. So you're not able to hold your urine as much as you were previously able to. You get constant itchiness and infections, and sex becomes more of a chore and a displeasure compared to what it was. And so these are things that you're going to have to look into, and cosmetic gynecology provides solutions to that. Now, again, back to childbirth and menopause, when our external genital structures age, they start to look different, and we can't run away from it.
Like that's with everything goes
south. Your face, your breasts, everything, and so does the vulva. And so for some, they're like, I don't care, how that looks. But for some, it becomes a problem in that they're not able to carry out their daily activities. They're not able to have sex. They're not able to walk sometimes. They're not able to have their exercises. They're not able to wear the things that they'd like to wear because now the labia majora or minora are saggy and longer than what they wanted them to be. And that can happen.
So you're using technical terms, but we can visualize.
You can, right? I'm glad, because just imagine like lots of, sagginess and drooping and things being much longer than they'd like them to be. And the problem with this situation is that, if you're brave enough, you can, tell your friends or your sister or your, whoever is close to you. Like, look, this is what is happening to me. Is this also happening to you? Am I the only one? And, so on and so forth. But there are some women who are not able to do that. There's some women who do not have that kind of confidence or those kind of relationships where they can openly speak about it. And it's bad enough that you can't speak about it, and there's no solution to it.
Yes.
So I usually tell women, look, you don't have to be extremely vocal about it. I'd love it if you are vocal about it and you talk about your problems. But if you aren't, if nothing else, you can know that in cosmetic gynecology, there is a solution to all of these problems. And the solution is available in Kenya. So for me, that's the most important thing. And at some point, you might see a cosmetic gynecologist because you will have a baby. And if you don't have a baby, you will age.
Yep.
So you will see a cosmetic gynecologist.
So it's inevitable.
I feel like it more or less is. People say that, you are vain, to want your vulva to look a particular way. But I say, if this is something that makes you feel better, and this is something that, makes you have better sex, or you're now able to, jog, and now you couldn't previously because your labias were just rubbing together too much.
Wow.
What's the problem in having that sorted?
Yeah. I know, because there's a lot of things, like, again, maybe something that we need to unlearn, that we've not been brought up to be comfortable to talk about these things, and it's completely natural. It's very normal. I think you've said vagina so many times.
I don't think a day goes by when I don't say vagina. Maybe Sunday.
I'm wondering, people are still watching this. Come on. But no, the fact is that we need to normalize this conversation, and that's why it's important, it's empowering for women to know that this is also available for them. You know, they don't need to go and advertise it. Maybe they just need to come and see you and feel happier within themselves.
Within themselves.
And it's not, like you said, and it's not necessarily about a better sex life or whatever. It's just to feel good or to feel better. And I think that's really important as well. I just think it's so amazing that you've brought this to Kenya. How do you feel to be a trailblazer?
You know, people usually think that I feel awesome and I've brought something new and I'm, you know, running with it, but I don't always feel that way. Many times I'm like, oh my God, are people going to accept this? You know, is this particular treatment going to work for an African woman? Yes, I can see it's working for a Caucasian woman, but is it going to work for an African woman? You know, how do I market decently? You know, without making it look like, you know, you're trying to sell something that, you know, people are not ready for. It is a very sensitive area. And many times, even by the time people have come to my office, they're already, you know, very embarrassed about what they're about to say to me. And embarrassed to say that, look, I do want a better sex life. Look, I am having trouble in my marriage, and I think that this might be the thing that can save it. And so it's easier said than done. It feels good to be called a trailblazer, but I can tell you many days I don't feel like one. I really don't. I feel like one when a patient sends me a review like, oh my God, we are having such a much better sex life. And I'm like, okay, maybe I am a bit of a trailblazer. And so it feels good on some days, but on other days, it makes me kind of introspect and think, okay, how can I make this better? How can I make more Kenyan women know about this? How can I, you know, market it decently? How can I even convince the people who come that, look, this is going to make you feel better. I know you've never heard of the OSHOT, but it will make things much better for you. And so it's mixed feelings. It's good things like that, yes, I have, you know, changed a lot of women's lives already. I have introduced something new that's gonna keep evolving, and there are people who are gonna follow in my footsteps and, you know, make these solutions, you know, more popular in Kenya. But being a so-called trailblazer comes with so much doubt. Self-doubt, and I'm a perfectionist. I always want things to be, you know, good, and so there's lots of self-doubt that comes with it. I try to, you know, teach myself that, look, you shouldn't doubt, or just do it and see what happens. Many times I tell myself.
I think when in doubt, maybe just call your grandmother. Right?
She's biased. She's not the best. What are you talking about? Go and do it.
There you go. And that's what we need in life, right? Just that voice sometimes. Thank you so much, Kristina. I really have enjoyed this conversation. I look forward to so many more. I think this is, like you said, for women, I don't think the conversation ends here. I think we're going to see a lot more of you. I think people will be more open to listening to stories about their vag. Of Lalushka. What is it?
Lahalish.
That one. Kristina and I would love to hear from you. We'd love to know what you think about what Kristina does. Is it something that maybe you think about having a consultation with her? What do you think about how she's been brought up as well? Do you bring up your children in the same way with, you know, just teaching them that they are magic? We'd really love to know from you what you think. Make sure you leave a comment below. And like I said before, share this video because it's important that you engage and that when we know that you're here and you're watching. Thank you so much for being here. We really do appreciate you joining us every week. And remember, on the show, we encourage you to be brave enough to learn, to unlearn. Thanks for watching. Bye-bye.